Today I am going to tell you myths and realities about psychologists. If I ask you in general what is psychology and who are psychologists, people would give different answers, but the most common answer would be psychologists can tell everything about you just by looking at you, or psychologists can read mind, they are astrologers, they are face reader, they are omniscient, etc. So, the first myth about the psychologist is that psychologists are mind readers. So, I can say that psychologists are not mind readers. This is a pure myth that psychologists are mind readers. They are not. They can do it by using some psychological tools, and without tools, some of things about you can be predicted by your body language, and that may be true also and may leave you in surprise. But if you want to know about yourself scientifically, you need to go through some psychometric tests. Let us understand this by a very common example. Suppose you are not feeling well and having fever from the last few days. Now, what would you do? You would go to the doctor, and the doctor would suggest you some testing as your fever is persisting for a long time. You will go to the pathology and make all tests suggested by the doctor, then by the pathologist. The testing report would help the doctor to diagnose your problem. In the same way, if a person wants to know something about his personality, his attitude about something, his areas of excellence, his level of aspiration, etc., he also needs to go through some psychometric test. Only then the psychologist would able to diagnose or measure that particular thing you want to know by applying respective tools. And one very important thing which needs to be clarified here is that the accuracy of a psychologist's prediction about you and his diagnosis about your psychological problems would depend upon truthfulness of your response. If you respond under some social pressure and give the wrong responses, the prediction would also be wrong. Just like if you give other person's blood for your testing, that testing would not diagnose your problem. So the more honest you are in giving the responses to question of certain tool, the more accurate predictions would be made about you. So psychologists are not mind readers. They they measure your personality by implementing some psychological tool, and they actually describe your behavior, explain your behavior, and on the basis of that measurement they can predict your behavior. And if there is any problem or some behavioral modification is needed in your personality, they will also do that. So the myth that psychologists are mind reader is absolutely absurd, and the reality is that psychologists are not mind readers, they are not face readers. They are also very scientific. They also measure all these things, all your personality traits, in a very scientific manner, just like a doctor does. Now, the second myth about the psychologists are that psychologists can help only mentally unstable people. In other words, we can say that people often believe that only crazy people go to psychologists, and psychologist is not for everyone. So, psychology is meant for whom? Psychology is meant for only crazy people. This is the myth about psychologists. But this is not true. The reality is that psychologists help people to come out of their problems. They apply techniques to help people to make wise decisions. They help them to maximize their potential through encounter groups. They help people to explore their unique domains, and they make them to live peacefully and satisfactorily. Because the primary task of a psychologist is to explore your personality. What are your hidden impulses? What is your level of anxiety? What is your personality type? By implementing some type of psychometric or projective techniques. And once they come to know about your personality, about your level of anxiety, about your level of achievement, about your level of aspiration, they can help you to improve it or in a positive direction. So, psychologists are not meant only for the treatment of crazy people or the people who are not mentally stable. Psychologists are there to help everyone. They help people to grow from negativity to the positivity. But unfortunately, we are still stigmatized that if a person is going to a psychologist, he or she is not mentally stable or having some mental problem. But this is completely wrong. People go to the psychologist even for their betterment, that is, for developing their core skills, boosting their self confidence, knowing their self esteem, and making themselves prepared for dealing with their social, emotional, spiritual, and psychological problems. So, the myth that psychologists can deal only crazy people is absolutely wrong. And the reality is that psychologists are the helpers who help every individual to excel in their lives. The third myth about psychologists are that psychologists and psychiatrists are the same. Both these terms, psychologist and psychiatrist, are often used interchangeably, but these two persons are entirely different because they require different type of degrees and their line of treatment is completely different. Because psychiatrists require a medical degree like MD, while psychologists require a doctoral degree in psychology. And psychiatrists prescribe medicine for the problems, while psychologists use different type of psychotherapies for the behavior modification of people. For example, they can apply different type of cognitive behavioral therapies, aversion therapies, learning therapies, cognitive therapies, rational emotive therapies, and there are so many others therapies which a psychologist implement to treat the patient to get rid of his or her problem. But the thing is that the psychologists are not authorized to prescribe medicine. A psychologist can help you by implementing some psychotherapies on you, but as far as medicinal part is concerned, psychologists are not authorized to prescribe you a medicine. But as far as psychiatrists are concerned, psychiatrists deal you by giving you some type of medicine, some antidepressant, etc. So the domain of psychologists and psychiatrists are completely different. So the myth that psychologists and psychiatrists are same and these terms are often used interchangeably, it is completely wrong. And the reality is that since the requirements and domain areas of both the persons are entirely different, so these two persons are completely different and they are not the same. So in this section, I have discussed the most common myths about psychologists. So that's all for this section. And in my part two of myths and realities of psychologists, I am going to discuss some other common myths and realities about psychologists. So that's all for now. Thank you.